What are the most common conditions you're finding that can be preventable or extremely treatable in the very early stages through known diagnostic? What are the most preventable and treatable health conditions that can easily be caught through diagnostics?
Yeah, so I mean, the leading cause of mortality worldwide is ischemic heart disease, atherosclerotic cardiovascular disease, and that is largely preventable. There are obviously genetic predispositions. I've seen 20-year-olds with heart attacks, but those are outliers. Most of the time, it's lifestyle choices in addition to genetic predisposition. And most of the time, this takes decades to develop, which means you could intervene at any point and prevent progression. Some of the phenotypic markers that we'll see, something that a patient may feel for even discussing labs, would be increased waist circumference. As we age, we get beyond our 20s and 30s. All of a sudden, the foods you were eating when you're a teenager are now making you pack on body weight, or you're exercising the way you used to exercise 5, 10 years ago, and now all of a sudden you can't keep up, or poor sleep. You're sleeping at night, you toss and turn, you get up 5 times to go pee, you wake up in the morning, you're exhausted. Some of these are more subjective measures, but obviously blood work is incredibly important. I mean, you mentioned it. This isn't, maybe it's a customary thing. I'm not sure. My dad is the same way. I literally just forced my dad to get labs through Marek Health because he would not get labs otherwise. He would not see a primary care doctor. Here I am, his son's a doctor, his daughter-in-law's a doctor, and he would just refuse to go to doctors. So it's really, really important because there are certain things that you may not feel yet. You're not going to feel your arteries clogging until it's gotten to a point where it's now not allowing blood to flow through that artery sufficiently, and it's causing damage downstream. That's when you feel symptoms. That's when you start to feel chest pain, angina. That's really when we're starting to worry about heart attacks, strokes. That's too late. And some lab markers that you can get now could prevent that from happening 20 years later.